Good morning, friends. Welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe my channel and also please give your valuable comments. And you can also visit my playlist. In the playlist, I have provided almost all the topics in a very systematic order, so you can make use of it. Now, in the last three classes, we are discussing about the PARIGARBHIKA. In the first class, we have seen the basics, definitions, etc. In the second class and third class, we have seen the pathology of this particular PARIGARBHIKA, and we have also critically analyzed it. Now, once there is development of malnutrition, that means child is deprived of nutrition because of the causes which I already mentioned, like poor spacing, hormonal imbalance, poor breast milk secretion, poor emotional bonding, poor maternal bonding, poor handling of the weaning period, poor complementary feeding, etc. So that makes the baby more vulnerable to develop the nutritional disorders, nutritional deficiency, okay, like malnutrition. Now, once this process starts, then how it will proceed further, how the pathology goes further, as explained in Ayurveda. We will see. Now, if you look into the symptoms which are mentioned here, the second line, Kasagni Sadha Vamatu Tandra Karshya Aruchir Brahmai. Then comes Yujjate Kostavridya. So these are the only symptoms mentioned here because he explained the whole pathology of this malnutrition in a very shortest way. Okay, Kasa Agnisada Vamatu, then comes Tandra Karshya Aruchi Brahma, then Kostavridya. These are all the only symptoms which are mentioned. Let us understand these symptoms one by one. So what he says is Agnisada and Aruchi. Kasa Agnisada. Kasa we'll see later. Agnisada and Aruchi. So this is the first thing which happens. Okay. So due to all the above causes, there will be disturbed digestion and metabolism, which leads to loss of appetite and aversion to take the food. Okay. So why this malnutrition is developing? That is because of so many issues we have already discussed. And once there is malnutrition, a malnutrition baby will have a lot of problems with the appetite. Okay, so refusal to feed will be there, reluctant to take the feed will be there. He will not take anything. If you take it also, it is not properly get digested. Many issues are there. So due to all the above issues, so there will be what it actually suggests? It suggests the disturbed digestion and as well as a metabolism. Because digestion requires so many enzymes. These enzymes are nothing but protein. That protein is deficient. Okay, metabolism requires so many proteins, so many enzymes. All the enzymes are made up of proteins. Protein itself is deficient in the baby. So naturally we can assume that the digestion and as well as metabolism both are get affected. And that is the reason why child is developing Agnisada and as well as Aruchi. Now breast milk is the best milk for the baby, especially for the infant, as it is readily available and completely absorbed. Completely absorbed. Now once there is a lack of breast milk, okay, so now what happens? If the breast milk mother is giving, breast milk is best milk, it contains all the contents which is required to the baby, especially for the first 6 months of the baby, and all the contents which are present there completely get absorbed, there is no wastage. But in this situation, when breast milk is not available, so what mother will do is, mother either go for Datri. If the Datri is also not available, then mother has to go for the supplementary feeding, animal milk or other supplementary feeding. Okay. Now, lack of breast milk compels the parent for the early introduction of the solid and alternative diets. Okay. Now, child is not in a position to digest this alternative solid foods or alternative milk or supplementary milk because the digestion and metabolism itself is damaged because there is no enzymes or hormones produced properly because of lack of proteins. So now when mother go for artificial milk, which is most commonly the choice of animal milk, artificial milk, the early introduction of an external food or milk that leads to increased risk of indigestion and frequent diarrhea and vomiting. This is quite common when we give the supplementary food to the baby early or too much in over amount. So usually child will either develop diarrhea, vomiting because it is out of digestive capacity of the baby. Okay, baby has got limited digestive capacity. When you overfeed the baby, it is not able to digest it and metabolize it. So same when occur recurrently, when this cycle occur recurrently, mother is giving something, child is not able to digest it, there is a vomiting, there is diarrhea. When these do continue, Okay, or sometimes there may be allergies also, cow's milk allergy, etc., or celiac disease, etc. So same when occur recurrently, it may end up in malnourishment of the baby. Okay, so baby develops malnourishment. So contamination, suppose if the mother is giving top feed, another risk is that contamination of the top feed. Okay, with the breast milk we don't have this problem, but with the alternative feeding like supplementary feeding or animal milk feeding also, so we have got contamination of the top feed and also artificial milk, which makes the baby more and more prone to infection. This makes the baby more and more prone to infection. Now, bottle feeding will going to increase the risk of diarrhea, and the bottle is considered as the biggest killer of the baby. Bottle feeding is, we know that. So usually when you go for the artificial milk, we will go for bottle milk feeding, and mother, because already mother is psychologically she is now occupied. Okay, another child is growing, another fetus is growing inside the uterus, so focus is there, all the focus is focused to that particular point. Now second child will be given with some artificial milk, that also in the bottle. Okay, so bottle feeding will now again increase the risk of diarrhea, and bottle itself is called as second biggest killer, bottle itself is called as biggest killer of the baby. So in the due course of the time, what actually happens is child's general health status drastically falls, because bottle feeding, recurrent infections, opportunistic infection, recurrent diarrheas, and mother is also not properly able to give the care to that baby. No, due to all this, a drastic decrease in the health status of the first child, and the general condition of the baby completely falls down, and there is emaciation, and now there is failure to gain the weight. Child is not able to gain the weight. In other words to say, we say growth velocity chart will falls very significantly. Okay, the expected we have got at least what you say, about 6 to 8 kgs of the weight has to be gained in the first year of the life. Okay, about 25 centimeter has to be gained in the length should be gained in the first year of the life. So these are all the basic parameters, and the child is not able to achieve this particular milestone. Okay, so growth stunting will be there. So growth fault will flatter, growth chart will flatter. Now when we go further, when the same condition persists for some more time, few more months, what happens when the above condition persists for a longer time? That result in the stage of emaciation with the loss of general health. The essential proteins, fat, carbohydrate, glycoproteins, and lipids which is required for the brain growth are no more available due to lack of breast milk, disturbed digestion and metabolism, and as well as slowly child land up in a condition called as marasmus. Land up in a condition called as marasmus. We know that, and the same condition has explained Kasagni Vamathu Karsha. So therefore Ayurveda says Karsha. So next symptom is a Karsha. Agnisada will be there, Aruchi will be there, then comes a Karsha. Next, Kasa and Vamana. Next set of symptoms is Kasa and Vamana may occur previously also when the mother is feeding the artificial milk and all. A marasmic baby is more prone to upper respiratory tract infection. Now, we know that child is in the stage of immunocompromisation and marasmus. Now, this baby is more prone to any type of infections. So, these infections are quite common, especially in the children. Upper respiratory tract infections are quite common. So, that upper respiratory tract infection has been represented by a single word called as Kasa. Okay, a marasmic baby is more prone to develop upper respiratory tract infection and gastrointestinal infections, which leads to cough and also vomiting that further deteriorates the condition of the body. Now, Kasa Vamana. Vamana refers to GAT infections and Kasa refers to upper respiratory tract infections. So, both these infections are quite common in immunocompromised baby with the marasmus. Next set of symptoms is quite interesting. Then he says Brahma and Tandra. The next set of symptoms is Brahma and Tandra. Now, this usually in the marasmic stage, you do not develop any Brahma and Tandra. Brahma and Tandra are the very prominent symptoms which are seen in the kwashiorkor. After marasmus, in the PM we have got two things, isn't it? One is marasmus, another kwashiorkor. Marasmus is the first stage, kwashiorkor is the second compromising stage. Okay, so when child is impending towards kwashiorkor, child will develop so many mental symptoms. Mental apathy will be there. Okay, dullness, mental apathy, etc. Now, these symptoms are mentioned by these two symptoms here. What is that? Brahma and Tandra. So when child develops Brahma and Tandra, it suggests that affliction of the brain growth due to the lack of breast milk, as breast milk is very very important for the brain growth. It contains so many essential fatty acids etc which is required for the proper brain growth. Okay, therefore we say breast milk is always best for the brain, cow's milk is always best for the body. Okay, so this shows the affliction of the brain growth. Brahma and Tandra will be there. The same also occurs in case of Kwashiorkor. The child will be psychologically dull and slowly go through a stage of compensatory mechanism, uh, which may lead to a dull, apathetic, and inactive child, and it does not show any interest in the surroundings, and child is little bit semi-conscious. This is typically you get in case of Kwashiorkor. Okay, so the same symptomatology has been explained by two words, that is Brahma and as well as Tandra. Okay, so child with Kwashiorkor, its surroundings and may undergo the stage of delirium and semi-consciousness. Same thing is also seen in Kwashiorkor. In this way, when the child completes the first year, when the child completes the Kshirada Avastha of the life, it land up in a malnourishment stage. Land up in a malnourishment stage. So during the second year, when child comes to the second year, Kshiranada Avastha. Okay, so already we know that in the Kshiranada Avastha, Agni of the child is unstable. Aniyamita Agni, we say, Kashyapa says. So which further deteriorates the condition. First year over. Second year, already it is a stage of deterioration of the Agni, unstability of the Agni. So here the problem further get worsened. Now there is another important symptom which is mentioned as Brahma Tandra Yujyate Koštavridhyacha. Now this is quite interesting. The disease is also associated with the distension of the abdomen. Here, if you look into the Kwashiorkor, in the later stage, there is a distension of the abdomen. One is because of generalized anasarca, generalized swelling. Second is, there is Kwashiorkor, one of the very important symptom presentation is hepatomegaly. Hepatomegaly. Now, probably this edematous condition which leads to ascites-like conditions, okay, ascites-like condition, along with the hepatomegaly, probably it has been mentioned as total Koštavriddhi. Total Koštavriddhi. So collection of the edematous fluid in the Kwashiorkor, okay, and another is hepatosplenomegaly. Third one is paralytic ileus, because there is lot of electrolytes has been lost. There is no potassium, etc. So the what you say functional obstruction of the intestinal loops will be there. There is no peristaltic movement. So the intestinal loops which are functionally get collapsed may lead to the edema-like condition, that is obstruction-like condition. So that might have been referred as a Koštavriddhi. That is also called as paralytic ileus. Or as I told, it may be because of hepatosplenomegaly. Third one is usually a child with the marasmus, so it will get into the position of lordosis due to normal lordosis in the second year. Okay, so usually in the second year, usually child will have some lordotic gait. Okay, now in a child with a malnourishment, this lordotic gait may be more pronounced. That may also give the appearance of Koštavriddhi sometime. Anyway, we can take all these things, but one thing is very clear. The author is very, very clear. Okay, author is very clear about the process of development of this Kwashiorkor. Hence, PARIGARBHIKA explains how a child get humiliated by the nutritional deficiencies, psychological deficiencies, okay, and the weaning problems, etc., and develops a Kwashiorkor-like condition, which is almost all similar to the explanation of a PARIGARBHIKA as mentioned by Ashtanga Sangraha. But one thing is very important here is if I confidently correlate this particular disease with Kwashiorkor, now skin changes are the striking presentation in the Kwashiorkor, because protein is equally important for the manifestation of for the formation of the skin layers also. So that is very prominent over here. But in PARIGARBHIKA, if you look into the symptomatology, there's not even a single skin manifestations has been mentioned. Kasagni Mamatu Sada, then Tandra, Brahma, Koštavriddhi, they are mentioned. But there is no skin manifestations. Why this is possible? Because probably in India, okay, probably due to less incidence of Kwashiorkor incidents in India compared to marasmus. Incidence of marasmus etc. is quite common in the Asian countries, whereas incidence of kwashiorkor etc. is quite common in the African countries. You can see in the Somalia etc. Malnutrition problems. So there the child is more not marasmic, they are kwashiorkor. But in Indian continent or Asian continent, most probably we look into the babies, we will get the babies with marasmus. So probably Kashyapa belongs to the Asian continent, therefore he is not much acquainted with such manifestations, because skin manifestations in kwashiorkor are seen at the last stage, at the most end stage. Pavement like dermatitis, like that, mosaic dermatitis, many types of dermatitis. So they are the manifestation in the end stage of the disease, usually. Okay, so probably as this kwashiorkor is less common in an Asian continent, Kashyapa may not be knowing this disease, may not be knowing these symptoms, and he is not mentioned here properly. Okay, but another important is Kashyapa actually, of course, it's not Kashyapa, it is Vagbhata who mentioned this PARIGARBHIKA. So Vagbhata might not be knowing. Kashyapa not explain this disease with the name PARIGARBHIKA. Okay, but Kashyapa explains a disease of similar symptomatology in the context of Jataharani. So when he explains the Jataharani, he mentions that woman becomes pregnant again while the first child is already feeding, then the prior child will definitely die. Okay, so then he says that the first child will going to die. He is not mentioning any disease name, but he is just giving an explanation, Kashyapa, in the context of Shushka Revati Jataharani. Okay, so there he says that if the mother is already feeding the baby, meantime she is pregnant again, then the first child will going to die. This explanation he has given. A similar explanation is given by the Kashyapa in the context of Garbhajafakka also. In the Garbhajafakka also, Kashyapa mentions almost all similar explanation when he explains the Fakka. So separately he has not mentioned the name of PARIGARBHIKA, but under the heading of Garbhajafakka, Kashyapa very clearly mentioned Fakka Roga. We have got detailed videos are available in the playlist. You can look into it and you will get all the explanations. So thank you very much. In the next class, in the last class, now we will go for the treatment of PARIGARBHIKA. So that we will see in the next class.